Hello and welcome. Today, we're going to try and unlock the science of pharmacology. It's the fascinating world behind every single pill, injection, and prescription you've ever heard of. Let's dive right in.
Seriously? Have you ever thought about that? How does that tiny little tablet you take for a headache know to ignore your foot and go straight to work on the pain in your head? It really does seem like magic, but it's not. It's actually a pretty brilliant science.
I love this analogy because it's so true. Getting into pharmacology can feel super overwhelming at first, kind of like opening up a brand new, really complicated board game. But once you learn the basic rules, the whole thing just starts to click. And that's our goal today, to get you the rules of the game.
At its heart, pharmacology is a two-way street. It's not just about what a drug does to your body, it's also about what your body does to the drug. This back and forth, this constant interaction is really the core of everything we're going to talk about.
So, here's our roadmap for today. First, we'll tackle the two pillars of pharmacology. Then, we'll learn how to crack the code of drug names. And finally, we'll see how it all comes together for safe and effective use out in the real world.
All right, let's get into the two core principles, pharmacokinetics and pharmacodynamics. Yeah, they're big words, so we'll just call them PK and PD. Think of them as two chapters of the exact same story. You really need both to understand the full picture.
Okay, if you remember just one thing, make it this. It's so simple but so important. Pharmacokinetics, or PK, is the body's story. It's all about the journey a drug takes through you. Pharmacodynamics, or PD, is the drug story. It's the action the drug takes on you. Let's start with the body's side of things, with PK.
So this is the four-step journey of pharmacokinetics. People often use the acronym ADME to remember it. First, the drug has to be absorbed into your system, maybe from your stomach. Then, it's distributed all over your body, usually through the bloodstream. Next up is metabolism, which is how the body chemically changes the drug to break it down. And finally, excretion. That's just how the body gets rid of it, often through your urine.
Now, when we talk about metabolism, there is one absolute superstar player, the liver. Think of your liver as this incredibly sophisticated processing plant. It's packed with these special proteins called enzymes, especially the cytochrome P450 family, and they're like tiny molecular workers that just break down most of the drugs we take, getting them all ready for removal.
So that's what the body does to the drug. Now, let's flip the script and look at pharmacodynamics. What does the drug do to the body? Well, the action really starts when a drug molecule, our key, finds its specific target, which is a receptor on a cell. That's the lock. This precise fit is what kicks off the drug's intended effect.
And when that key fits into the lock, one of two things usually happens. An agonist is like a key that turns the lock. It activates the receptor and causes an effect, basically copying one of your body's own signals. An antagonist, though, is different. It's a key that fits perfectly into the lock, but then jams it, so the body's own keys can't get in, and the signal gets blocked.
All right, now for something I think is really cool. We're going to learn the secret language that's hidden inside drug names. I know they seem totally random, but there's a system to it. And I promise, once you see it, you can't unsee it.
So every drug actually has three different names. The chemical name is basically a chemist's description. It's super long and complicated. The trade name is the catchy brand name you see in commercials. But the one we really care about, the one that's the key to the whole code, is the generic name.
Let's just take ibuprofen, for example. I mean, look at that chemical name. You would never ever ask for that at the pharmacy. You'd probably ask for a brand name, like Advil or Motrin. Or you'd use its simple, elegant generic name, ibuprofen.
Okay, so here's the secret. That generic name isn't just a random word. It's built with these special parts, called stems, that act as little clues. And these stems are actually designated by international groups to create a universal language for medicine. They tell you what kind of drug you're looking at and what it's supposed to do.
And this is our decoder key. See that stem, statin? If you see that, it tells you it's a cholesterol-lowering drug. So if someone is prescribed atorvastatin, you immediately know what it's for. The same thing goes for Olol. That means it's a beta blocker, or Pril for certain blood pressure meds. It's an incredibly powerful shortcut.
Okay, so now that we can kind of decipher these names, how does that translate to making safe decisions in the real world? Well, in our last section, we're going to see how all this knowledge, the PK, the PD, and the drug names, is actually put into practice. Because, understanding the science is the first step, but applying it safely is what truly matters.
Right, this knowledge isn't just for a test. For doctors, nurses, pharmacists,
For any healthcare professional, this is the absolute foundation of every prescription they write. It's what allows them to choose the right drug at the right dose for the right patient. And that's essential for preventing mistakes and getting the best results.
And here's a structured way to apply all of this. The World Health Organization actually lays out this 6-step process. It's just a logical journey, right? First, you figure out the patient's problem. Then, you decide what you want the treatment to achieve. Step 3 is so important. You make sure this specific treatment is right for this specific person. Only then do you write the prescription, give clear instructions, and finally, and this part is key, you monitor how it's going to make sure it's working and it's safe.
And it all comes back to this famous quote from Paracelsus, a physician from way back in the 16th century. It really is the soul of pharmacology. Pretty much any substance, even water, can be harmful in the wrong amount. And this is exactly why understanding how the body processes a drug, its pharmacokinetics, is so incredibly vital for getting the dose just right.
So we'll leave you with this question. The next time you're handed a prescription, you're now armed with the basics of pharmacology. What will you ask to become an active, informed participant in your own healthcare? Thanks for joining us.